Hi, my name is Shantel Prince. Welcome to NYC Health and Hospitals Kings County's YouTube podcast. Today I'm joined by physician assistant Sonia Nash and Fred Harry to give an introduction to the physician assistant profession.
Happy to be here.
Hi Shantel, how are you?
So today we are going to discuss what a physician assistant is, the role of a PA, a physician assistant or PA, the origin of the PA profession, education, training, and credentialing, and more. So let's begin. Sonia, can you take it away with what is a physician assistant?
Physician assistants are licensed clinicians who practice medicine in just about every specialty there is, under the supervision of a licensed physician, which usually delineates our scope, and we are able to practice within every specialty in the medical field.
So Fred, how long has the PA profession been in existence?
So that's a really good question to ask. The PA profession actually started back in 1965 by Dr. Eugene Stead. However, the actual first PA was as far back as in 1950. There's a doctor by the name of Dr. Amos Johnson who had his first doctor assistant, Henry Lee Buddy Treadwell. And he actually created the template, so to speak, for which PAs practice today. However, the first program was started at Duke University back in 1965 under the leadership of Dr. Eugene Stead. And so the first graduating class was October 6th of 1967. Interestingly, that was the birthday of Dr. Eugene Stead also.
Oh, wow, that's great to know. So how can one become a PA? What education and training is needed?
That was a great question. PAs are educated at the master's degree level. The program is quite rigorous. It's modeled after medical education that doctors go through. It can take as much as 28 months to 30 months to complete the program. As a physician assistant, upon completion, you're required to take a board exam. After passing the board exam, then you can practice in the respective states. What's interesting about the PA profession, there's only one entity that supervises or monitors the board certification of PAs, and that's the NCCPA. So once you have that board certification, you're able to practice in any specialty or subspecialty in medicine.
Yeah, exactly, Fred. Most of the programs are 27 months in length, and we do a didactic phase and a clinical phase where we do 2,000 hours of clinical rotations in medicine, surgery, OBGYN, pediatrics, emergency medicine, psych, in all areas of medicine, and then we can go on to practice in those areas.
Would a PA student need any form of prerequisites or prior medical knowledge before coming into PA school?
I think it would be an advantage to have some prior medical education. There are instances where you have paramedics or athletic trainers or even medical assistants who have met the basic requirements in their bachelor's degree training and move on to applying to PA school. I think that level of experience does enhance that person's ability to complete PA school successfully. And keeping that in mind, as you go through the program, you are required to complete about 2,000 hours of training. So it's very intense, it is rigorous. You have to basically dedicate yourself to becoming a PA.
Imagine learning everything about medicine in just 27 months. It's rough.
I can imagine that because we've all been there, right?
Yes.
So, scope of practice. PAs seem to have a very broad scope of practice. Can you talk a little bit about that, Sonia?
Well, PAs have specific duties that depend on their setting in which they work, their level of experience, their specialty, and of course the state laws in which we work in. Generally, we take histories, we do physical exams, we make differentials, diagnosis, we order, interpret labs, tests, etc. We develop plans with our teams that we work with, prescribe medication, counsel, perform procedures, assist in surgery. So within that scope, of course, with our licensed physician, it allows us to work in every aspect of medicine within a very specific niche like ICU or neurosurgery to something more broad like internal medicine, or primary care.
Yeah, just to add, Sonia, I think it's important to note that there are approximately 180,000 PAs practicing in various specialties in the 50 states and the District of Columbia. And that enables us to really bring critical care or bring care to patients that are in need. I think one point I want to go back to is that when we spoke about our founding fathers, Dr. Eugene Stead, and the introduction of the PA profession, one of the things that they focused on then was how can you bring care to patients in underserved communities? And that was one of the key components in terms of developing this profession. I think over the years, we have been able to not only demonstrate that PAs could deliver care in primary care settings, but in all settings within medicine, including some of the most challenging, such as emergency medicine, obstetrics, critical care, etc. So PAs actually play a very critical role in providing comprehensive care to our patient population. I think it's really important to highlight the fact that with the training that we get, the medical model that we follow, that enhances our ability to align with our supervising physician and be a team member as we do patient-centered care. I think that is really important because that is where medicine is moving today. In doing so, we're able to actually affect patients in a positive way, looking at the patient in a more comprehensive approach. And with the supervision that we get from our supervising physicians, it does enable us to build confidence, but it also enhances our education as we continue to practice within that field.
So being that PAs work in a team setting to ensure that patients are receiving the most optimal care, I know that PAs work alongside many other healthcare professionals, physicians, nurses, and nurse practitioners. Can you explain the role of PAs as part of a healthcare team as they collaborate with physicians, nurses, and other healthcare providers, such as nurse practitioners?
Yeah, PAs are committed to team practice. That means that with our physicians, our nurse practitioner counterparts, nurses, and other members of the medical team, I think at the end of the day, it's important to know that the patient comes first. And so that team approach is critical to ensuring that our patient gets the best care. Our supervising physicians are our leaders, and they provide the leadership that is required for us to practice and enable us to take care of the patients that we are trusted to take care of.
Sonia, how then can one differentiate a PA versus another healthcare provider, such as maybe a nurse practitioner?
Well, I think that our education models are different. Nurse practitioners are educated on a nursing model, whereas physician assistants are educated on a medical model, just like the physicians. We have similarities within our professions, but there are some differences. PA education is focused on general medicine, comprehensive review of the medicine, all aspects of medicine. The nurse practitioners, I believe, have to choose a population-based, or family nurse practitioners have to choose a population-based focus, like pediatrics, women's health, family practice. So those are some of the differences that exist within our professions.
So PA curriculum are modeled after the medical model. I think that training really enhance our ability to be able to be deployed in many specialties. Just looking back at the COVID pandemic, for example, PAs were actually instrumental in providing care, not just on the outpatient basis, in hospital, in critical care setting, in emergency room settings. PAs were one of the group of providers, notwithstanding physicians, but providers that were able to be deployed in just about any and every specialty there was. And so PAs played a very important role when it came to providing care for patients during the pandemic.
Thank you, Sonia and Fred, for joining us today to highlight the PA profession. The points that you all made were very insightful, and I'm sure a lot of people will take away some type of knowledge from this conversation. Thank you, everybody, for tuning in to the first episode of this season's PA podcast, and we're looking forward to you joining us for our next episode.